All right, so my name is Dylan Hoffman. I'm a first-year student in the Indiana State DAT program. With me today is Luke. Luke, you want to tell everybody a little bit about your role, what you're doing?
Sure. So I work at Tarleton State University in Stephenville, Texas. It's a Division II school. We just started a master's degree in athletic training, entry-level program. I think this will be our fourth year to have students from that are in our program. So I serve as a preceptor in there, just in the clinical setting. I don't teach any courses or classes related to that.
Awesome. And Luke is also the head athletic trainer with the football team as well.
Oh, yeah. Probably should have said that.
It's all right. So how long have you been in a preceptor role?
I've been in a preceptor role between here and when I worked at Texas State. So I would say just over 6 years.
Okay.
As a.
And then in your current role, how many students do you supervise usually at a time?
It varies from semester to semester. During the season, there will be between 6 and 8 students, just depending on the size of our program. During the spring, it will be 4 to 5 students. Again, depending on how many students are in our program.
Do you feel like that's a reasonable number, or do you feel like it should be more or less? How do you feel about that?
It just depends. As far as when it comes to working with the sport and things like that, I think that reasonable number, probably yes, 7 to 8 is good. But as far as being a preceptor, it's really difficult to do each one of those clinical competency sheets with them or CIPs, and then to do all of the meetings with them for midterm evaluations, final evaluations, especially when we're in season. There's just not as many hours during the day to have extra stuff outside of working with football, and then also with track and cross country going on. It makes it really difficult to get those things in an appropriate setting.
Awesome. So your role right now at Tarleton, if you were kind of to describe it in one of these categories, would you put it as it's your dream job, a good fit, a step along the way, or something else entirely?
I wouldn't say it's a dream job simply because I don't really have, I guess, a dream job idea. But it is a good fit. I get a chance to work with a lot of students. I think I'm the only preceptor in our entire program that gets to work with every student that comes through our Masters of Athletic Training program. So that part of it is pretty awesome in that I get to make a lot of connections with the students. I get to hopefully impart a little bit of knowledge to them on things. I mean, I get to know most of them. So it's kind of been a good, or not kind of, it has been a really good experience in that aspect of it. As far as I would like to be able to do some more teaching stuff when I get a chance to, but right now it's a really good fit. I enjoy what I'm doing. And so I think at least for another couple of years, I could see myself being in Tarleton.
That actually kind of answered my next question I was going to ask you, which was how did being a preceptor or your role as a preceptor play into your perception of your setting? So it sounds like you enjoy it for the most part. Enjoy the preceptor role.
I do enjoy the preceptor role, minus some of the requirements as far as the meetings and things like that with the students. Not that I don't enjoy meeting with the students, just that, like I said, the time demands sometimes aren't exactly kosher with how things are set up with the football schedule and then just class schedules and those things. But I do enjoy doing it.
And so how do the hours spent working as an athletic trainer with football and track compare to the hours that you get to spend educating students?
I would hope that there would be some overlap. I try to get students in here as much as we can, just so that they can see how the athletic training room works, but also so that they have more opportunities to see athletes, to work, whether it's rehab plans, whether it's evaluations, whatever it is. And then if we don't have athletes, that gives us a chance to sit down and have, some discussions about things. Every semester I try to do something a little bit different just to see if we can improve the amount of learning or critical thinking skills or whatever that the students are carrying away from this rotation. And so this semester we'll see, I'm having my second year students, whenever there's free time, I'm kind of challenging them to teach the first year students, even if it's something that they haven't gotten to in class yet, as far as evaluation wise or modalities or things like that, just both as a refresher for those second year students, and then it gives the first year students a little bit of an opportunity or an advantage, since they don't have the same amount of study time and things that some of the other classmates do.
Yeah. So how would you define the way that you provide that mentorship, or how would you kind of define your style of mentorship with students? I know you kind of touched on it a little bit just then, but
I would like them to be self-sufficient, and so not in that they have to learn everything on their own, but I want them to think critically about things. I want them to, rather than just coming up and asking myself or one of the two certified graduate students that I work with, instead of just coming up and asking us, hey, what is this? Or, what settings did you want me to use on ultrasound? Or what kind of rehab did you want to do with this person? Rather, I want to see them come up and say, hey, I would like to do ultrasound with this person because blank, and these are the settings that I would use to achieve that goal. So that they're better able when they get out of here, rather than just doing things because they've done them in this athletic training room. I want them to be able to know why I'm choosing a particular treatment or why I'm choosing a particular rehab exercise, and then have them be able to do that on their own. I also want them to ask questions, but I mean, as you know I hope from my time at Texas State, I usually don't answer the question directly. I want you to go look it up and put some effort into it too, because you learn a lot more that way. And so sometimes my kind of teaching style or mentorship style can seem a little bit rough from the outside, but at the same time, I want all of these students to be successful, and I don't want them to have a false idea about what the profession entails as well.
Mm-hmm. So, and this is, I guess, the next question is kind of a little self-reflection on you, but how do you feel like you do a good job in that area? If so, if not, what kind of barriers do you think keep you from being successful as much as you would like in the mentoring?
So yes, I do think that I do a good job, but I would like to improve in some of those areas, as far as being able to spend more time going over, say, special tests, or going over some more difficult or complex aspects of athletic training, such as designing a full rehabilitation plan for 6 months or 8 months for an ACL or a Bankart shoulder repair, something like that. I don't really get the opportunity to do that too often with our students. Even when it comes to them working with an athlete for rehab, we don't always have time to sit down and say, all right, we're going to go over your rehab exercise from today or for the next week. So on that end, I would like to do better on that aspect of talking through some of their thinking on why they're doing certain things. I don't know whether that's feasible the way that things are set up right now, just from a time point perspective. And I know that all of us are busy as athletic trainers, and I don't want to use that as an excuse. At the same time, I mean, you've worked college football, and you know the demand of practice time and then treatment time and all those other things that are pretty much a requirement of the job. And then the students are in classes, during the morning time, and they don't have the same, schedule for those things either. Mm-hmm. So I guess the answer to your question, a long way of saying that, is yes and no. I want to improve on some of the things that I'm doing, but at the same time, I feel that when students leave here, they at least have a pretty good idea of what is entailed when they get out into the athletic training world, from both the hours and then the work expected and things. I try to give them as real a perspective as I can without overloading them.
Yeah. So the last question I have for you may seem, I guess, a little out there, but we'll try and tie it back in a second. But what excites you the most about the profession of athletic training?
What excites me the most about the profession? I'm excited that we are seeing athletic trainers get more recognition from coaches, from athletes, uh, when it comes to how they are working with athletes. And then even in other settings, we're getting recognized that we are pretty good at the things that we're qualified to do. Uh, and so I'm excited about just that people are starting to recognize athletic trainers as more than just, you know, who we are as far as running onto the field when there's an injury or giving water to players. Like there's way more to athletic training than that. And so I'm excited in the direction that it looks like our profession is moving. Um, we'll see. I mean, I think it'll take 10 years or so to really know whether some of those decisions that have been made recently are going to be really good for our profession. But the other thing that really excites me about athletic training, and something that I've really started to notice more, is that a lot of these, especially in my setting at college kids, I'm sure other settings as well, but we're just seeing so many of these kids are struggling with things outside of athletics, and being able to feel comfortable talking to them about those situations and being able to help them, where not just are they going to be a successful athlete, but now they have some tools to work through some of those issues off the field as well. It's been exciting to see, some of our athletes here at Tarleton that I've referred out to different counseling services or whatever, and to see them not just, recover from whatever issues were going on mental health wise or whatnot, but to see how once they are back in a good frame of mind, how much more successful they're able to be in athletics and even off the field. So, I mean, that's just a couple of the things that I really, look forward to and am excited about with our profession.
Awesome. And so, last question to kind of tie what you just said back into the preceptorship. How do you feel that you model that excitement, or your excitement about those things? How do you model that to your students?
Oh, that's a good question. I don't know that I model that extremely well. Um, I don't know. Part of what I try to do is, I mean, be here every day. When just be available for the athletes, which sometimes means that I'm going to pick them up if they don't have a ride, or taking them to doctor's appointments or those things. And so from that end, I think kind of modeling just that we are, providing not an all access, full service, whatever, to athletes, but at the same time, I'm taking care of more than just their physical, athletics needs when it comes to working with athletes and understanding what makes them tick. So on that end, I think that I do an acceptable job of modeling that. As far as the excitement, I don't know. It's just I hadn't really thought about that before, and so I would like to say that I think I do a good job. But like I said, I'm not sure that I do a great job of modeling that for the students, other than trying to have a good attitude every time when I come in, trying not to, say I have a bad, day, personal life or whatever, try not to let that affect how I respond to people in the athletic training room, and trying to stay positive, when you have those difficult situations and things. That's a good question, man. I'll have to actually think about that some.
Yeah, no problem. Well, that's all the questions I have for you. I know you have a busy schedule, so thanks for taking the time to come and meet and talk with us.
Well, thanks, man. I always enjoy talking to you. I hope things go well for you in your program there at Indiana State.
Thank you. Thank you. Have a great day.